Good afternoon. This is Dr. Bhupesh from Dr. BKM Institutes, and our contact number is 76967342256. And today we are just starting this role play, and that's the one we have got. So we, being a nurse, the patient is 70-year-old who has had a bowel resection for colon cancer. So there was colon cancer, so he had bowel resection. He was obese but lost a lot of weight in the last few months. Since his or her hospitalization, she has given up smoking. So basically, the person has quit smoking as well. Upon recovery from the surgery, she is due to start chemotherapy and then radiotherapy. So that means the surgery has been done, the bowel resection has been done. Now the patient is looking forward to chemotherapy and radiotherapy. Answer the patient's question and give a reassurance about the cancer treatment. So basically, the first task that you have been given, whatever the questions patient may ask, so you have to reassure the patient about the cancer treatment, that this is the best treatment that you can get. Reassure the patient he will be looked after. That is why reassure word is given, because doctor would have already assured. So after doctor, you are reassuring the patient that this is the best treatment for the cancer. He will be looked after, and explain that she leaves hospital, you will ensure spot is available. So when you will be discharged from the hospital, so that means patient will say, oh, I'm worried that who will take care of me at home, that there is nobody to take care of me, I am all alone. So tell him that we will ensure that support is available. Answer the patient questions in a reassuring manner. Make sure that the patient has no further concerns to dealt with. So whatever the questions may be that patient may have, everything should be dealt in the best possible way. So मैं आपको ये टास्क अच्छे से बोल के दिखा देता हूँ, and that would be nice. So good morning, my name is Bhupesh. I am your nurse. So how are you feeling now? Well, nurse, kind of all right. I have already undergone this bowel resection what doctor recommended. Now I don't know. I'm getting suspicious about the treatment. Well, could you please tell me, why are you suspicious about the treatment? What is making you suspicious? Like, why are you doubtful about the treatment? Well, see, nurse, my brother and my father both died of cancer. They underwent the same treatment, but we could not save them. And now this is happening with me. I am also 70-year-old. So I think I would also have the same end. Well, in that case, I would like to say that, see, every patient has a different condition, and you should not judge yourself or your condition on the basis of what has happened in the past. I am really sorry to hear about the loss that has happened to you, that you have lost your brother and your father with same condition. So obviously I understand the psychological trauma that you might be having. But let me tell you that each and every patient is different. Their condition is different. Like in your case, you were diagnosed in the early stages of the cancer. So doctor has already done the bowel resection. So in your case, the prognosis is good, and doctor feels that you are going to be absolutely fine in the coming times. But nurse, see, I have seen in the past my brother and father undergoing this chemotherapy and this radiotherapy. That is what doctor has recommended, this chemotherapy and radiotherapy. I know that these are very bad. They have side effects, weakness, nausea, hair loss. So I'm really worried about that. Well, we do understand, and I totally agree that there are certain side effects of the treatment that you are getting, like of chemotherapy and radiotherapy. So yes, hair loss would be there. You might have the feeling of nausea and vomiting, but to be honest, this is the best thing that you can do, because this is a procedure that is conducted when a person has cancer. So doctor has already removed the cancer part, but there can be certain cells that are left behind. So if those cancer cells are left behind, they have the chances of regrowing into another cancer. So it is very important to undergo chemotherapy and radiotherapy to prevent any reoccurrence. And that is why these two treatments, chemotherapy followed by radiotherapy, is very important. And nurse, another thing, I am all alone at home as I have lost everyone. So, I'm all alone. Nobody is going to take care of me when I leave the hospital. See, I assure you that you will be well looked after, even over here. And when you will leave the hospital, we ensure you that you will get the best support which is available after the treatment. So you don't have to worry about anything. You would be well looked after here in the hospital, and even after the hospital, you will get the best treatment and the best support would be provided to you, whatever is required. Okay, nurse. Okay, so do you have any other query? Is there anything that is making you worried? Well, no, nurse. It's just the possibility of cancer returning. Well, I have already told you each and every patient is different. And if you will follow the right protocols, if you take the medications on time, if you get your chemotherapy and radiotherapy done on time, then the chances of reoccurrence is very less. And in your case, as you were diagnosed in the early stages, so your prognosis is altogether different from your family members. And I'm really sorry again to hear about their loss. But in the end, I would like to tell you again that in your case, you are supposed to get fit, and doctor is expecting a good recovery. All right, nurse, thank you for giving me reassurance and making me feel comfortable. Well, that is part of our job, so there is nothing to worry. And we assure you that we will provide you the best services. If you have any problem, you can press the buzzer beside your bed. We all are here to take care of you, and we assure you for the best services. Take care. I am leaving now, so you take care. So this is how you execute the role play of 5 minutes. That is how the time is consumed, because sometimes we are worried that how would the time be consumed, because there are so many things, the time is less. So in that case, that you can consume your time in a better way. So now you may ask me any questions that you may have. I am unmuting you guys. So you may ask me any questions whatsoever you would like to ask. Please, any questions? Any questions? So have you all understood well? आप सबको समझ आ गया है?
Yes, sir. Understood, sir.
All right, guys. Then I'm switching off this recording. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Please leave your queries. The people who are watching us on YouTube, thanks for your lovely comments, lovely compliments and wishes. It means a lot. Thank you so much. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you.